Hi, everybody. My name is Breana Turner, and I'm currently a Master's of Public Health student pursuing my Master's in Public Health with a concentration in community health practice. I also hold a Bachelor's of Science degree in kinesiology, and I'm the founder of a mentoring program called Sisters with Ambition, which is a mentoring and empowerment program for middle and high school young women. So for my personal story of public health, I fell in love with the field when I was a first semester freshman, and I began to learn about how public health is not just only a disease prevention area and field, but also it marries the unique opportunity to fight and advocate for justice, to also discuss various issues that contribute to health disparities and health within this country and also the world. And I am sure that now more than ever, so many people have been hearing about public health, especially in March and February and the onset of the coronavirus and COVID-19. With that being said, more recently, I would like to argue that we're now fighting two pandemics, one from coronavirus and COVID-19, but then also most of the country has decided they now want to wake up to understand that racism is still very prevalent in the United States of America and also the world. And now we are fighting racial injustices, not only in police brutality, but in the institution of the United States of America itself. So with that being said, my intentions behind this discussion are only merely just scratching the surface about racism within this country and what it has done in terms of health and in terms of women's health and Black women's health specifically. I completely understand that throughout history, Black women have had to overcome and be resilient. And we've adapted the superwoman syndrome and mantra in order to continuously overcome. And while I completely sympathize with that, personally, I just don't believe that superwoman and holding a cape and being larger than life are sustainable or even healthy, just for ourselves, but then also in how other people treat us, especially within the healthcare and health field industry. So before I begin, I understand that these are extremely, extremely heavy topics. So I want everyone to unclench their jaw, to relax their shoulders, and take a deep breath and be able to receive the information from a place of hopefulness and also understanding that when we dismantle these systems, we have to be educated and understand what we're up against, that this has been going on for generations and for centuries. And in order to get better, I want us to be educated. There is a James Baldwin quote that says, "Nothing can be changed until it's faced." So again, I'm going to be merely just scratching the surface about some of these pressing issues, but I hope that you guys will continue to do your own research to learn about the inequities in the healthcare system and how it continues to persist today and perpetuates the superwoman and superwoman syndrome and narrative within the Black and African American community. So before I begin in diving deep into the topics, we have to have some terms that I need to define that I'll be using interchangeably throughout this discussion. The first term is public health, and that is the primary level of disease prevention concerned with the population as a whole. So when I think about public health, those are your agencies like the CDC, the NIH, and people that work at the health department. And also we have medical racism, and those are the prejudices and discriminations in medicine and healthcare based off of perceived race. Then we also have disparities, health disparities, and those are preventable differences in the burdens of disease that are experienced typically by marginalized populations. And those health disparities are typically related to history, socioeconomic status, political sides and political views, and also social. And those are just a few of the factors that contribute to health disparities. There's actually a pretty long list. And then we finally have institutionalized racism. So these are discriminatory practices within an organization and institution. All right, now I'm going to get into a brief history lesson, and I am going to start. So when I was about a senior in high school, I learned about the woman Henrietta Lacks. And prior to learning about Henrietta Lacks, basically the only bioethic health issue that I learned about pertaining to Black and African American people within this country is the Tuskegee experiment. And long story short, the Tuskegee experiment went on for decades. And that's when Black men who had syphilis were being experimented on by the government in order to find a treatment for syphilis. And the government did find a treatment, but they actually never treated most of these men. And so many men died unnecessarily. But I did not hear about what happened to Black women. And when I learned about Henrietta Lacks, it was extremely eye-opening and troubling the more I dug into her story. So Henrietta Lacks was actually born Loretta Pleasant, and she was born in Roanoke, Virginia on August 1st, 1920. People are unsure about how she made the change to Henrietta Lacks, but she definitely had an interesting life as well as childhood. And if you have heard about the book, The Immortal Life of Henrietta Lacks, I would highly, highly, highly recommend that you read it or even watch one of the movies about her life. So in 1951, Henrietta noticed that she had a knot in her lower abdominal space, and eventually she did give birth to a baby, but that knot that she experienced never went away. She also had some other symptoms that were extremely concerning. So her husband drove her about 20 miles outside of where they lived in order to go to Johns Hopkins University Hospital in Baltimore, Maryland. Now, when I read about the conditions of this hospital, I wasn't necessarily surprised, but I was just saddened and shocked that they had to drive out of their way in order to be treated at a facility that was completely comfortable treating Black and African American people. Additionally, this hospital also serviced the poorer side of the community as well as people that might not have had health insurance. So when I'm just thinking about all those different factors, I knew right off the bat that that hospital most likely did not have the best resources and probably did not have the best care for Miss Lacks as well as so many other patients that went to the hospital. So the gynecologist ran some tests, took biopsies, and she was treated at the hospital for cervical cancer. And when they removed the tumor in order to do a biopsy on it and look at it underneath the microscope, they also held Henrietta Lacks's cells in 2 vials. And between 20 and 24 hours later, her cells just kept replicating. They kept replacing each other. And this was something that the scientists had never seen before, because typically these cells would just die off and then they would take a biopsy from another patient and then they would just die off. But with her cells, they coined them as immortal. Again, nothing that they had ever seen before. Now, it's really typical for doctors and surgeons to take biopsies, but what is atypical and extremely concerning about Miss Lacks's story is that she never gave them consent to send her vials of cells throughout the United States of America and even internationally. And because of her cells and because the scientists sent them so many different places, she was able to contribute a lot to science. There have been treatments for leukemia, from Parkinson's, just because of Henrietta Lacks's cells. Some more troubling information about Henrietta Lacks is that the scientist actually shortened her cell's name to HeLa cells to disassociate the fact that these cells came from a Black woman. And also when they referred to where the cells came from, they called her Helen, again, furthering her identity from who she is as a Black woman. And they never provided an opportunity for her husband or even Miss Lacks to even have consent about her HeLa cells. And it wasn't until about 2 decades later where her family actually learned how much she contributed to science and the fact that they never had the opportunity to say yes or no. To me, that's one of the first things I learned about how Black women's bodies had never necessarily been valued by the American medical system. And as I took a deep dive into Mrs. Lack's story in the book, Immortal Life of Henrietta Lacks, I learned about something else at 23 years old called the Mississippi appendectomies. This honestly disgusted me as I learned that so many African American women within Mississippi and honestly across the United States of America have gone through sterilization practices without their consent or knowledge. And Fannie Lou Hamer, who is a famous civil rights activist as well as voting rights activist, actually was the survivor of a sterilization method that was used in Mississippi. She went into a routine surgery in order to remove a small tumor, and she came out having a hysterectomy. And it is estimated that about 60% of the women that went into Sunflower County Hospital in Mississippi actually were sterilized. Again, like I said, these sterilization practices have taken place across the United States, and they're not even that old. They're pretty recent. I'm talking about in the 50s, in the 60s, and the 70s. Some people have cited that these sterilization practices took place in order to decrease the amount of people living on welfare so that the government did not have to take care of them anymore. Now, to go back even further to discuss how ingrained these practices of Black women's bodies not belonging to us, there is a man by the name of James Marion Sims who was coined as being the father of modern day gynecology. So if you've ever been to a gynecologist and you've seen some of the tools and you're like, there's no way a woman made these, surprise, you're right. A woman did not start creating some of these inventions, and some of them that are even used today. So James Marion Sims was a man who owned slaves, and in order to conduct his research, he used enslaved Black women and operated on them without anesthesia in order to perfect his medical practices. Not only did he do this with his own slaves, but people nearby donated them or sold them to science in order for him to come up with treatments to understand women's bodies. And after he was finished operating on these Black women, he went on and operated on white women and used anesthesia and pain medicine on them. The reason why he did not use any anesthesia on Black women is because he said that Black women do not experience pain, or they experience pain significantly less compared to a white woman. And he was not the only person that agreed with that notion, and that also validated what his ideologies were. The reason why this is extremely concerning to me is that in 2016, a study was conducted by UVA School of Medicine, University of Virginia, which is located in Charlottesville, Virginia, and their first, second, third, and residency students, most of them believed that Black people have thicker skin. Now, maybe they're talking about, the physiological skin that is thicker, or maybe they're talking about something figuratively that they're able to take pain. Regardless, that is extremely troubling because these are people that are going to become doctors one day and actually practice on an individual. The study went on to say that the thicker skin narrative and the idea that Black people do not experience pain is something that is still embodied in present day times. And with the opioid epidemic that is taking place in the United States, studies have found that because doctors and other practitioners do not believe Black people's pain levels, they are less likely to receive the proper pain and care management as compared to a white person in the same facility experiencing similar pain levels and symptoms. When I think a little bit more critically about the notion that Black women or Black people don't experience pain, I think about how Black women are 3 to 4 times more likely to die during childbirth because of the implicit and explicit biases that have been ingrained in the medical system dating back to the 1800s and probably beyond. In 2018, a study by Cynthia Prather stated that because of slavery, Jim Crow, Black codes, and segregation and civil rights era, these are all contributing factors to the medical racism and the health disparities that we experience and see today. The reason why I am emphasizing that so much is because if you've ever been to a doctor's office and you have said that you are in pain and they don't believe you, sis, it's not you. It's not you at all. And I'm not making any excuses for these doctors and these nurses, but it's been ingrained in the system. And this is what we are up against. And this is why I'm so passionate about letting go of the superwoman syndrome and letting go of the notion that we continuously need to be strong and continuously need to suppress any type of pain or tiredness that we're feeling, because it's so detrimental to our health. And these doctors and nurses are never going to be held accountable unless we continuously speak up. Not only do Black women suffer disproportionately from maternal mortality, but when I think about heart disease, and I'm sure that several people have probably seen the tweets online or tweets and Instagram posts about how they had a friend or they knew a woman who went to the doctor because she was having just weird pains in her arm or her chest, feeling nauseous, really tired. And the doctor is like, oh, it's just stress, or oh, it's just anxiety. And they write her off. And then several days later, they end up in the hospital and they're actually suffering from a cardiac episode, or worse, they actually unfortunately have died. These are problems that continue to persist because, again, that implicit and explicit biases that are occurring within the United States medical system. I even read a reflective essay from the antithesis of a Black woman, and that is a white man who had to reflect and think about how he has been trained on the basis of white privilege and how he's taken that into his medical practices with him and how he's treated patients, but now knows he needs to do it differently and obviously educate himself. It's extremely troubling that so many doctors, some that have admitted it and some who have not admitted it, continue to practice on the basis of white privilege. Just from a minor medical standpoint, when I go to the dermatologist, sometimes they literally look at me in the face and like, oh, I've never seen this before on a Black person's skin. And that's the reality of these textbooks that have the institutionalized racism. That's the reality of people who've learned from the textbooks. So again, this is knowledge that is so important as we work towards dismantling a system that was never meant for us in the first place. Now, of course, in the case of COVID-19 and coronavirus, the Black community has been disproportionately affected by the pandemic and the outbreak. And I was actually appalled when the onset of the pandemic was taking place, when high-ranking public health officials and health officials within this country cited that the reason why Black people were dying or suffering more from coronavirus was because of underlying health conditions. I think I almost launched myself across the kitchen table and onto the TV screen. My parents had to calm me down because I was going on a rant about how that is irresponsible and it paints such a limited viewpoint about the things that are taking place in order to keep Black people from having health within this country. So essential workers, when we think about the essential workers right now in the coronavirus outbreak and pandemic, those are mostly Black individuals or individuals that identify as people of color. Now, these grocery store workers, drivers, and sanitation people, they have little to not great health insurance. And then on top of that, they have little time off. Now, when we think about the built environment, so that is, the way that neighborhoods are structured, the way that housing is structured around highways, for example. There have been plenty of articles that have come up about how this one town across the bridge has had so many different deaths. And the highway that separates the more urban environment from a more suburban environment, the suburbs actually may have had 1 or 2 deaths. That is built by design, and that is, again, that institutionalized racism that contributes to those health conditions, that contributes to Black and brown health within this country. There's also been an influx of doctors leaving the inner city or leaving the urban environments in order to go to the suburbs in order to make more money and to not take Medicare or Medicaid. Again, that is detrimental to the health of minorities, especially Black people within this country. And then, of course, there is distrust. And why wouldn't there be when I just told you about 3 key events? And those are just documented ones that I know about. There's plenty of events that have happened within American history that have directly targeted Black women and Black people as a whole that contributes to the distrust that we have with the medical and with the health system. And quite frankly, I don't blame us. I really don't. Now, when we think about the testing facilities that take place in order to get tested for COVID-19, most of these testing facilities require that you have a car. And if we think about critically about who's essential workers, how the pay gap exists with Black people within this country and within Black women, the reason why we can't have access to some of these testing facilities just because we don't have a car is so ingrained in pay gap. It's so ingrained in credit scores. It's ingrained in people not being able to get loans or auto loans. And it just seems like so many things working against us. Additionally, there have been plenty of testing facilities that have been pulled out from these environments, and they're going to cater to the more suburban places or areas that people may deem as safer. And then finally, I know plenty of Black women that are even intimidated and scared to go to the doctor's office. And that makes perfect sense, again, because of history. And then on top of that, there is a disconnect between medical literacy and actually understanding some of these terms from a social and cultural standpoint, which further contributes to why we might not be treated as well or being as healthy or experiencing deaths during the COVID-19 and the pandemic. But also at the same time, again, like I said, this is a lot of heavy stuff. And it's the reality of the situation. And I want to shed a light on so many different factors that might be working against us during this time. Well, that are working against us, not might. And so I also want to offer some hope, a glimmer of hope to all the different situations and everything that we've learned so far. So recently, I think within the last 2 days, there has been a viral tweet that has gone on, and a Black woman went in for surgery, and she went in with maybe 2 braids, and she came out with 6. And that's because the man that operated on her was a Black doctor, a Black physician, and he took the time to braid her hair neatly so that her head would not have to be shaven. And then on top of that, he used staples instead of stitches. That is one example of why it is so important to have representation within the health field on all standpoints, from doctors to pharmacists to nurses to PAs, PTs, public health clinicians, and scientists. It is so important to be able to have a rapport with someone that looks like you, that maybe will be able to define terms in a way that are culturally and socially relevant to us to make us feel more comfortable. In terms of maternal mortality within this country, California passed the California Dignity in Pregnancy and Childbirth Act in order to combat the high maternal mortality California has, but also it shows the rest of the country that this is an issue that needs attention. The doctors will go through implicit bias training, and they have to document better how many Black women died during childbirth and make the numbers extremely transparent. And Serena Williams continues to be an advocate for maternal mortality as well as Black women's birthing experiences. If it can happen to Serena Williams, who is a celebrity, who is a phenomenal woman on and off the tennis court, it's crazy how this happens to so many Black women within the United States and all over the world. The protests that have been going on specifically about police brutality and racism within this country have been endorsed by doctors, epidemiologists, public health clinicians all across the country, because they understand that when you take down institutionalized racism in one area, it trickles down and affects all areas. And institutionalized racism and medical racism within this country are, quite frankly, killing Black people and killing Black women, and they understand the gravity of the situation. Also, the American Public Health Association has released a statement regarding racism within this country, and so have many other prominent leaders such as governors, mayors, and health departments across the United States of America, who have been bringing attention to this matter and this topic at hand. Also, in terms of other solutions, I personally know some phenomenal Black women who are going to be nurses. I have a line sister that works in the labor delivery unit, and I know that she is doing her job and her duty and part being a Black woman in these spaces, being able to deliver and bring life into the world. My best friend is now going to be a cardiac nurse, which is extremely important. And I'm so proud of them, and that I've met some phenomenal Black women within my program that are going to move mountains and shift the narrative and be at the table in order to have these important conversations regarding health for Black women within this country. Also, I want to provide some more solutions that are more personal to me, but I think that they're so important. In terms of going to the doctor, doctors are humans. They're just people. I had a professor, and she looked at us one day and she said, doctors, no offense to any of the doctors I might be watching, but she was like, doctors are just people. I'm married to a doctor, and sometimes they're not that smart. And that was just so funny to hear from my professor, who's a woman who also has a PhD, that doctors sometimes are not that smart and they do not know what they're talking about sometimes, particularly when it pertains to your body. No one knows your body better than you know your body. In the same way that Black women have had a large voice in the most prominent movements throughout history, I cannot think of a better way to use our voices than to advocate for ourselves and the health of ourselves. So when you go into that doctor's office, if you feel comfortable, question everything, question why they're doing something, why they aren't doing something. And if doctors refuse to provide a treatment or provide a prescription, let them know to document that in your chart. Most of the time, they're going to change their mind, and that's a way to hold them accountable. At the same time, I want you guys to look and research who you're going to see what their philosophies are, if they're located on their website, if they have experience with Black women or Black people in general. Sometimes there's even Yelp reviews on doctors. Look into that and take those things seriously. And if you have a friend that is not afraid to go with you to the doctor's office, when that is deemed allowed again, bring them with you. Have another advocate in the room with you, or have someone that you can have on call in order to feel empowered and emboldened to take charge of your own health. And also, as we go through this historic and unprecedented times of 2020, please check in on other Black women during this time and all the time. Hold each other accountable for self-care and health, and help each other during this time. In my sorority, we have a motto, and in our song, we say we help each other, we know there's no other. And so help each other out. Hold each other accountable. Check in with your friends. We can never pour from an empty glass. And like I said before, my undergraduate degree is in kinesiology. And if there's one thing I learned from studying about the physiological side of muscles, is that in order to be at optimal strength, you need to rest and you need to be in good health to actually be strong. And so even though I'm trying to get away from the strong narrative in the sense that we're continuously able to take poundings and to just overcome and suppress, I am on the side that strength is not found in your ability to continuously overcome oppression, but it's found in your ability to take a rest, to say that you need a space to decompress, and to say that it's okay to be vulnerable. I believe strongly in my argument that the system of institutionalized racism and medical racism continues to contribute implicitly and explicitly to the superwoman syndrome we have been feeling and that we have continued to embody today. Again, I am not saying that as Black women, we have not had to overcome so many different things throughout history, but I am saying to continuously embody a larger than life persona and ignoring how we truly feel is detrimental to ourselves and our health. In order to continue to be voices of the movements, we need to make sure that we are taking off our cape and understanding that we are humans and that we are women. And quite frankly, we don't have to be superwomen. We are Black women, and that is enough. So before I end today, I am saying to you all, sis, please take off your cape. Throw it away. If you've ever watched The Incredibles, you know that Edna Moe says, no capes. So I am saying to you, no capes. Take it off, throw it away, tuck it away. If you want to look at it every now and then, go ahead and look at it, but don't put it back on. We are resilient. We are so resilient. But that doesn't mean that we have to continuously take beatings from society and from ourselves. So in order to fight the good fight and to continue, we need, and you all need to be in good health. And with that, I'm going to open up the discussion for questions for the next 10 minutes or comments. And thank you so much for listening to me today. Oh, thanks, guys. I was trying not to get distracted by the comments. So if you have any questions, let me know. And also here is my social media information for you to connect with me. online, and also to shoot me any questions, comments, concerns. And if you have any questions about anything, if I don't know the answer, I definitely will find someone that will know the answer, and I can point you to so many different directions for resources. Let's see if anybody is saying anything. Yes, I agree with you, Sydney. I wish I had this information when I started combating my own health issues as a teen. Absolutely. In my mentoring program, Sisters with Ambition, I teach them that middle school one is a really, really challenging time. I like to say that they're old enough to know better, but still young enough to not. And so with that being said, I always teach them the importance of continuously advocating for themselves and using their voice. We have a voice. There's no reason to silence that voice when it comes to us. And I just hope that they feel empowered to not only stick up for themselves, but also for others. So any tips to advocate for yourself with your doctors or medical staff? So for me personally, I'm an extremely inquisitive person, and doctors go to school for 4 years. They have to do residency, and they have to even do other specialized training depending on what area they've been in. Now, when it comes to asking questions, I would say take a deep breath. If you need to, write out notes prior to going into the doctor's appointment, because it allows you to get into your own, to not rely on necessarily emotions at that time, because sometimes going to the doctors is extremely emotional depending on what you're going for, but you already have a list that was formed from a place where you were not nervous, when you're not scared, and you were thinking extremely logically in approaching your health. So I would definitely say that take notes beforehand, look back at your phone, ask the doctor for a minute to digest. Doctors should have good bedside manners, and they should want to be in a space to help you. And if that's not taking place, leave and go find somebody else, because our health is important. And at the end of the day, you are paying for a service, especially if you are on health insurance or even if you're not. Okay. What do you think of the term independent woman? Do you think it perpetuates the CAPE syndrome? I personally do think that the independent woman mantra does perpetuate the CAPE syndrome. I remember when I was in high school, and for some reason, I'm 14, 15, 16, and people would be like, ooh, you're a strong, independent Black woman that don't need no man. And it wasn't even Black women and Black classmates saying this to me. It was white classmates. And it made me feel extremely uncomfortable, and I did not know why. But now I know it's because I was not seen as something that was necessarily feminine, as a person who had feelings, as a person who was allowed to be vulnerable. And for me personally, I do think that the whole independent mantra that has been wildly taken out of context has perpetuated the CAPE syndrome, because Black women have found themselves in positions that have we've had to do things for ourselves, by ourselves. And while I get that, again, in history and culturally, we've had to do that, I don't like how the independent woman thing has been taken completely out of context, and it has been taken to some extreme that is just not sustainable. I will definitely I will definitely look at the movie Forks Over Knives. Thank you for that. So I see a question for Lauren. So accessible and affordable mental health care. I personally don't know something right off the top of my head, but I have been seeing a lot of different resources on Instagram going around about affordable mental health care. So when I come across those posts again, I'll make sure to post it on my story, as well as create a highlight for resources for Black women so that we can all see that. I also like to say that I'm a huge advocate for mental health and mental health services. I started going to therapy back when I was a junior in college, and I just wish I honestly had started it sooner, because when you're in therapy, it's crazy how many issues or self-reflective times come up that you didn't even realize were bothering you in the first place. And again, I believe that we cannot pour from an empty glass. And it's so important that we're not only taking care of ourselves physically, but we're also taking care of ourselves mentally as well. Okay. Thank you so much for the kind words. So my question is, since as Black women, we should practice throwing our capes away, do you have any tips on how to balance wearing our capes and throwing it away? In other ways, how can we balance in fighting for change in the movement and taking time to rest? Excellent question. Definitely very thought-provoking at the same time. So One thing I've been learning recently is the importance of taking inventory of my feelings and addressing them and not putting them on a shelf for later. There's an analogy that I've heard where the more you suppress a ball in a pool, the more likely the explosion is on the outside. And as we continuously suppress our emotions, the more likely we are to have a moment where it's just boom, and we can't control it. So in terms of fighting for the movement, when you're fighting for the movement, be in that space. And when you maybe leave the protest or leave the talk or leave the forum or leave the city council meeting, take time to be off social media so you don't just keep compounding those emotions inside of yourself. Also, I would recommend thinking about the type of woman you want to be, the type of woman that you are. And if who you are right now or where you want to be does not align with the million and one things that you have taken on, whether it's helping out this person, helping out that person, not tending to your dreams because you're always putting somebody else first, think about and practice saying no or practice saying not right now in order to prioritize yourself and your health. No is a complete sentence, and no does not require an explanation. And that is something that I have to continuously learn and remind myself. And that is something that I know a lot of women are dealing with, especially when society has kind of always demanded that we provide an explanation for certain things after saying no. So it is definitely a challenge in order to balance fighting for the movement and balance taking care of ourselves. But we have to figure out what works for us in order to exist in this space. Okay, let me go back. Ooh, therapy for Black girls. That is awesome. Thank you so much for the compliments. Okay, so some book recommendations. I am still a public health student in graduate school. So as I learn more and start reading more out of just my textbooks and stuff, I will definitely, again, put some highlights on my Instagram for a public health reading. I also found some great articles pertaining to health, but as far as novels, I'm still building up my collection as I learn more in this space as a graduate student and then also as a future public health clinician and scientist. So I will make sure to do that on my Instagram and to highlight that as well. But I would definitely, if you haven't, I would highly recommend reading The Immortal Life of Henrietta Lacks because it's extremely eye-opening. And from that, you see so many other health bioethics issues surrounding Black women that are never talked about in history class. And it's extremely eye-opening as it pertains to society and culture today. Ooh, Therapy for Black Girls podcast. I really love that. I would highly recommend checking that out. Yes, Carmen, that is great. Therapy for Black Girls, definitely recommend. And the therapist and the person leading the podcast is extremely great. So we have about 3 more minutes until the conclusion of my session. Does anyone have any other questions as I scroll? So I see someone saying that they now have all Black doctors. That is absolutely awesome. I think that is definitely, that's the goal one day, to have all Black doctors, including down to the dentist. I love it. We love to see it. Thank you so much, Tia. Thank you, Sydney. It has been a pleasure today talking with you all. Again, please connect with me on social media. Follow the Sisters with Ambition mentoring program, Instagram and Twitter. And then also my personal Instagram page is Breana_Gabrielle. And the Sisters with Ambition website is also on the last slide too. So subscribe to our mailing list, learn a little bit more about our program. And thank you so much for your time today.